Hello, 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 hello. I hope everything is well. Just wanted to touch bases. We did not get a chance to go over some upcoming assignments as it relates to your virtual / clinical makeup day that is upcoming. I did want to go ahead and get this video out though for whenever the assignment is released. You'll have some concept of what that looks like. So on this assignment, you will notice that there are different simulation activities that you are required to do, trying to get you more engaged in the clinical setting aspect of it versus just writing out, do this, do this. But you'll note it on the assignment on what to do. There are two different simulation. There's one for FADavis, and then there's an assignment for ATI. This particular one is for FADavis, and how it works. We've done simulation before. Simulation just means you're acting out, or we've done live simulation in lab where we were acting out different scenarios. And so that's what FADavis has incorporated to help with learning, as well as ATI, which we'll be utilizing. But with FADavis, what you'll do is you'll log into your FADavis account. And for now, mine is saying instructor. So let me go ahead and launch MedSurge. MedSurge, I'm going to click preview student view because I want to show what it'll look like on your end. So I'll hit confirm. On the side, you should be able to go up to your assignments. On the side here, it lists all the assignments. It's already available for you to do. It's the seizure simulation. And what you'll do is you'll find Sims Seizure, Chapter 48, and you'll click Start. The thing with these simulations, you'll work through this by the knowledge that you've obtained through lecture as well as studying and things like that. You'll work through this. The thing with FADavis though is it will cut you off if you pose a safety issue with the patient you're caring for, with the patient that you're caring for. If they see that you're not safe, it'll cut the simulation off and you'll have to restart it. So you don't want to just go through this just willy-nilly, just going through it just for the sake of going through it. You have to be able to look at this as if you were actively taking care of a patient. So as you see here, it talks about it includes video as well as electronic health record. This is just like in a real life. The decisions you make and the actions you take will impact your client. So there are different pathways through the simulation, but only one optimal or right pathway. And the simulation may end early if you make a choice that comprises that patient's safety. So it will take you in around 30 to 60 minutes. You can do this as many times. I don't think it's set where you have to have it reset, but you can take this as many times as needed. So we'll go ahead and launch the simulation. And this is what it looks like. It looks like I'm going to be caring for Susan Jackson, a 36-year-old female, date of birth 5/7/19, She's allergic to latex and contrast dye. My simulation has started. You can actually view the transcript or you can listen. So this is like a handoff report. This is like report when you get ready to get report on your patients when you're in the clinical setting. So what we'll do is, let's listen to a little bit of it. Well, we'll listen to all of it because I want you to see how this actually works.
Susan Jackson is a 36-year-old admitted earlier today after a witnessed seizure. Her 12-year-old daughter observed the event, could not arouse her mother, and called 911. Susan came to the emergency department by ambulance after having a seizure at home. Her daughter reports that Susan was fixing breakfast when she fell to the floor and started shaking. Her daughter could not arouse her. When paramedics arrived, she was confused and disoriented. She had some lacerations and bruises from the fall and had been incontinent of urine. Her daughter said the seizure lasted 1 to 2 minutes. She has no history of seizures, but her husband says she's been acting differently over the last month, is more forgetful, and doing unusual things. She has also been having headaches, which isn't typical for her. She has no medical history other than childbirth times 3, and she takes no medications other than vitamins. Susan is alert and oriented times 3 now. She has no memory of the event, but remembers smelling and seeing strange things before the seizure occurred. Her vital signs are within normal limits. Her pupils are equal and reactive to light. She can move all her extremities, and grips and pushes are equal and strong. Lungs are clear, and pulses are strong. She reports a mild headache since coming to the hospital, rating it a 3 out of 10. She has an injury on the forehead, which is bandaged, and bruises on the left hand and upper arm. The paramedics placed an 18-gauge IV in the right antecubital location, which is patent. They did a CT scan of the brain in the emergency department and ruled out acute bleed. A neurology consultation has been placed with Valley Neurology Group. Their office says someone will be here within the hour to write additional admission orders. Susan's family is at the bedside.
Okay, you've listened to report. You can, again, view the transcript. That's everything that was just discussed. So you'll hit continue. And this is what will populate. You're actually the nurse that you will see in this video that's caring for the patient. You're able to review her history and physical information right here. It tells you pretty much like she has no significant history. She works substitute teacher. She's alert oriented. You can also view her vital signs, her intake and output. This is just as if you were caring for a real patient and you're checking on their chart prior to going into working with this patient. You see that she has orders. She's admitted to med-surg. She had ordered a CBC, CMP, UA, CT without contrast. We're able to review those results when we go under labs and diagnostics. We can come down and look at her labs. That's her CT report. We can go up here and look at her MAR. She doesn't have any scheduled medicines. And then we can look at the nurse's note. She was transferred, personal belongings. That was at 12:15. The time now is 10:30. I mean, it was 10:30, and then she was transferred. It's going in the opposite order. So 10:30 is when she first came in, then 12:15 is when she was transferred. You can see all of that information by clicking on these tabs up top. So you'll close your EHR, and then you'll go ahead and press play.
Hello, my name is Andrew. I'll be your nurse today. May I call you Susan?
Hi, Andrew. Nice to meet you. Yes, Susan's fine.
So you're technically Andrew.
Okay. Bridget is the RN and charge nurse on duty. You'll see her today as well. I thought your family was here. Did they go home?
No, the kids were starving, so my husband took them down to the cafeteria.
Well, that's a good plan. There's nothing worse than starving children.
They said they would be back around 1.
Well, great. That'll give me a chance to complete some things before they return.
And they tell us that these are real actors and actresses. We'll probably just run through this again Tuesday night. But I wanted to also just send out this video so those that like to start early, you'll have some concept of what this simulation will look like for FADavis as well as ATI. So you've listened to what they just said. You're just working through this. Every time you do something, you're going to hit continue. It does give you the option to re-watch the video before answering this question, because if you answer this incorrectly, it could throw you out of the simulation and you'll have to start over. This has to be done in one setting. You cannot exit the simulation and figure you'll come back and pick up where you left off. That is not the case. So let's look at this question. After receiving the handoff report and speaking with Susan, what action should the nurse take? Should the nurse review the CT scan report? Should the nurse scan the environment for safety hazards and implement seizure precautions? Should we collect vital signs and perform an assessment? So what do you think you would do as a nurse next? I would go ahead and scan the environment for safety hazards and implement seizure precautions. Because if I started collecting her vital signs and performing an assessment, what if she has a seizure and she's high up in the bed as she was? Do I necessarily need to review her CT scan report at this time? Not really. So let's click scan the environment for safety, and then we'll hit continue. If it lets you continue to this next video, more than likely you were correct. We'll work through this one and we'll get the next one incorrect on purpose, just to show you that it will kick you out if you're not being safe and doing the pathway that is going to result in optimal care for this patient. So we'll press play.
I'm placing your bed at the lowest position.
That was my concept as well. Looking at it, the bed was too high, the rails were down, you know, things of that nature. As a nurse, what would you do or think of?
Okay, the safety equipment will be here in case it's needed.
He's establishing airway if needed be by putting oxygen tubing there, suction canister there. These are seizure precautions.
I'm placing the pillows here for your protection in case you have another seizure. I'll replace them with the proper pads after they arrive from Central Supply.
Okay.
Does that hurt at all?
No, it feels fine. My husband told me that the paramedics had a hard time finding an IV site in my arm, but I don't remember any of them being there. It's the strangest thing.
From what your daughter saw and the reports from the paramedics and the emergency department, it does look like you had a seizure. Has that ever happened before?
No. I thought I was in great health. I'm starting to question that now.
A neurologist from Valley Neurology is coming to see you shortly. They have a great team of doctors who will help you figure things out. Now, let me get you checked over.
So he's set up. We watched your video. First thing we should do is implement those seizure precautions. We can replay the video if we need to, but we're going to go ahead and click continue. And it's going to ask another question. After speaking with Susan, what action should the nurse take next? Should I use a pen light to look at her pupillary size and response? Should I determine if grips and pushes are equal in strength and movement? Or should I obtain a set of vital signs? Excuse me. The correct thing I would think to do is to obtain a set of vital signs. So we're going to intentionally get this wrong so you can see what it says when you're working this out, if you do not go in the pathway that is optimal for patient care for this patient. We'll say we're going to check her pupil size and response. And we're going to hit continue.
I want to perform a focused neurological assessment first. I'm going to ask you what seemed like silly questions. Can you tell me your name, the date, and where you are right now?
They asked me this in the emergency department as well. My name is Susan Jackson. It's July 20th, and I'm in the hospital.
You get an A+ for that. Now I'm going to shine a bright light into your eyes to check for a reaction.
tell from that if I'm going to have another seizure?
No, but it gives me some baseline assessment information in case there are any changes.
Well, I hope there are no changes. That sounds scary.
Now I'm going to perform some other assessments of your neurological system.
Okay, we're going to hit continue. What action should the nurse take next? Should he examine her wounds and bruises, determine if she's stable or unstable, or document the findings? We're going to say he should look at her wounds and bruises. Click continue.
Must have fallen pretty hard when you had that seizure at home. You sure got banged up.
Yeah, my daughter said I fell backward, hit a kitchen chair as I went down. I don't remember it. She said I got blood on the floor, on our new rug.
Oh no, I hope you can get the blood out.
My brother-in-law is a carpet cleaner, so I've got a good resource to help me out.
Oh, that's lucky. It's fortunate you didn't need any stitches.
I agree with you on that.
We're going to hit continue. What is the next priority action? Are we going to chart a description of the wounds and bandages, place a consultation for a wound care nurse, or assess her vital signs? Remember, I thought the proper action was to assess her vital signs from the beginning. So let's say place a consultation for a wound care nurse. And knowing that that was incorrect, I wanted you to be able to see this screen. Your simulation has ended. This tells that she was brought, it just gives a summary of her patient outcome. It tells you remediation-wise and reflection-wise what your role of the nurse, wound care nurse, and you'll be able to review your results. So it says you earned 3 points out of a possible 8 total points. You would try again. So it gives you a concept of what that looks like simulation. You just have to work through that on FADavis. What I'm going to be looking for is optimal answers that are marked with green check mark. It'll give you a check mark, or at the end, it'll show you like as far as what your report or your results are. It even gives you rationales. Like after you do something, it gives you your answer. You should scan the environment for safety hazards. For someone at risk for a seizure, it gives you the details or the rationale. So I only earned 1 point after speaking with her because, like I said, it should have been a more focused assessment. I mean, it should have been something else that should have been done instead of looking with the pen light in her eyes. So this is simulation for FADavis. You'll work through that for seizure as part of your assignment, but just wanted to give you a concept of what that looks like. Simulation for FADavis. I'll do another video as it relates to ATI because that looks different. You don't have all these prominent actresses and actors in there, but it's still working through scenarios. All right. Again, this is FADavis. You'll go to assignments and you'll find seizures. And you'll be able to work it. It put me back in instructor, but you'll be able to find it.